I don't even know. I don't even know what is. What is it? There's a lot of cups going on here, and I don't even know what that was. Ladies and gentlemen, boys and squirrels, welcome to Gym Talk. My name is Cameron. I have here
Dr. Shayan Safar, physical therapist.
Dr. Shayan Safar, welcome. My boy, the guy that keeps me going. I appreciate you dearly. You know,
happy to do
from
so.
one bro to another.
From one bro to another.
That's it, man.
Yeah.
Today, we're going to talk about some interesting videos that you may see on social media. Shayan is going to bring his expertise in here with all things regarding mobility, stability, anything PT related.
Yep.
Right? That is your area of expertise.
And I hope so.
It is. Yeah.
Otherwise, I want a refund from grad school.
For all the schooling that you did. Exactly. And so we want to kind of dispel some myths. We want to look at some videos and kind of dive into whether these things are a viable means of treatment or if they're kind of just all smoke. So
sweet.
I have a video here. Let's go ahead and cue it up and let's take a look, man.
Awesome. I like what you called it.
What?
Weird ass cupping.
Yes. It's labeled weird ass cupping. So
Good Lord.
We saw this video and it is... I don't even know. I don't even know what is. What is it? There's a lot of cups going on here.
There's a lot of cups.
And I don't even know what that was.
Yeah. Right off the bat, that's way too many cups.
So let's go into this first.
Yeah.
What is the purpose of cupping?
Yeah. So interesting question. There's theoretical reasons why.
Mm-hmm.
Anything that's in wellness hasn't been usually as researched. There's not a lot of clinical trials on it. So we're kind of left with theoretical evidence, right? And so far, what we think of cupping is a few things. One, there's it's helping your fascial mobility train, right?
Okay.
There may be some truth to that. We're not 100% sure, right? Fascia is sort of this new thing. We know it's there. We're starting to find more and more its connection to the nervous system. It can have adhesions. And so we believe things like foam rolling, cupping, might hydrate the fascia, may loosen it up. So there's that one theory. Okay. There's another theory with cupping, which is sort of like similar to the idea of PRP, the platelet-rich plasma injections, where you're tricking your body to have a new injury, right? So whenever you get injured, there's an inflammatory process that happens that tries to heal that injury. Let's say it didn't fully heal because you ignored it, you didn't rehab it properly, and you're still stuck with that injury after 6 months, a year. Your body kind of stops caring, right?
Yeah.
So it moves on because you have multiple things you need to take care of in life. Your body has only a finite number of resources. You might be injured and it's putting some energy to that, but you also have to take care of your kids, go to work, all that stuff. So after a while, it says like, hey, we're done with this. Let's move on to the next thing. We've gotten what we can out of this. One of the ideas behind these treatments is like, all right, let's give it a local bruise to that area, right? So we haven't re-damaged the tendon per se, whatever the tissue is, but now there's a little trauma on the surface of the tissue that's going to restart the inflammatory process, almost cause a whole new healing cascade. Whether that's true or not, we don't 100% know, but that's sort of the theory behind it.
Okay.
The problem is with this video is it's not specific, right? When you're cupping the whole body, we're just causing way too much unnecessary trauma without the specificity of like, okay, we've had this bicep tendonitis for 8 months and it's not healing. Let's throw a cup on it either to loosen the fascia, because that might be what's going on, or let's kind of trick the body into being like, hey, there's still some irritation there. Let's send all the blood flow, right? That's what that bruising is. It's all the blood flow that has kind of accumulated there and is sort of stuck there.
Okay.
It causes the inflammatory cascade and stuff. If you're throwing cups on the entire body, you're just adding trauma. It's not specific, right? You can't send blood flow to the whole part of your body and just heal it all at once. It's like you're distributing your resources way too wide. And so it's counterproductive. You're just causing irritation.
Isn't, though, by virtue of having the bruising, you are sending blood to that area?
Correct.
Or is that...
Okay. Yeah, so when you put the cup there, right, it's kind of like lifting the fascia. It's causing a little bit of irritation. Blood goes there to deal with that, and causes a bruise. Then the bruise causes the inflammatory process. Then your body goes, oh, there's something going on there. Let's fix it.
Yeah.
Right? If you do that to your whole body, you're just kind of, it's just confusing everything. Right? Remember, all these things are rooted in theory also. So none of these are necessarily like
we don't have any clinical evidence that this thing is a viable means
of... And if there are, they're maybe anecdotal, they're probably low level. I haven't seen like... When we talk about research, there's levels of evidence, right? Usually the more subjects there are or the more studies replicating the same topic is the highest level of evidence.
Okay.
I haven't seen a systematic review of cupping working for a specific dysfunction. It's sort of a new thing. Or the practice might be old, but it's being newly researched, right? So everything I'm saying is rooted in theory, not necessarily practice, right? But yes, we do want to increase blood flow to the area. If somebody came to me with a bout of chronic tendinitis and I put 1 or 2 cups on it, deemed they were safe, right? They don't have any blood disorders or anything we need to worry about, it's worth a shot, right? Am I going to promise it's going to fix everything? No. But it might be a small thing that increases the inflammatory process, gets blood flow to that area. Am I going to cup their whole body? That's ridiculous.
Yeah.
No, that's like, it's me just trying to show a shotgun approach to fixing their problems. Now, if you go to the camp of, they have these fascial restrictions. Let's put the cups on them. It kind of like fascia coats the muscle. Let's kind of suck the fascia off the muscle, have them move so the muscle's sliding under the fascia. If you're going with that approach, then I understand you want a wider range of cups. But if you're treating everything, that doesn't make sense to me.
Yeah.
Why would somebody come to you for a local problem? And things are connected, right? You can have back pain or foot pain that's related to glute weakness. You can have shoulder pain that's related to poor abdominal coordination. People have neck radiculopathies because they don't breathe through their diaphragm. They use their scalenes, right? Things can be connected. But I'm not soft tissuing their big toe, right? There's a chain. There's a physics problem that we're trying to solve. I'm not throwing cups on everything.
Yeah.
That to me is just like a kind of lazy way of just approaching a problem. To be honest.
I mean, it's probably more so for the social media, for to get the eyeballs on it and stuff, and it looks like, holy smokes, this is insane. I want to ask, is there any credibility to the idea that the darker the area, the spot is, the more toxins are there that are getting released or anything like that? Or do you think it could just be the fact that there might be a little bit more pressure there?
Yeah. Maybe there is. I haven't seen any evidence that suggests that. I think more than likely the low-hanging fruit here is the longer you leave it on, the more pressure it is, it's going to cause more tissue trauma. I've used cupping, and I still do sometimes. It works pretty well on loosening the IT band when it's appropriate. If you slide it up and down, you'll get like a light level of red. But if I leave it there for 10 minutes and really because when you cup, you're sucking air out to create that tension, there'll be a gnarly bruise, right? I'm not convinced that it has to do with a certain level of toxins. Hey, we don't know everything. It's possible. But if you ask me to put money on it right now, I'd say no. That's not true.
It's like a crazy hickey.
Yeah, right? Yeah. I mean, look, there are things we don't understand about the body. There are toxins that accumulate because our bodies are trying to...
I mean, it's such a broad term. Like, what does that mean, toxins?
Correct. It could be a vitamin that you have too much of.
I have no idea.
Yeah. So we can get into that. Even I'm not an expert in it, right? But let's say it's something that your body doesn't naturally accept, or you can have vitamin toxicity from getting a healthy vitamin, but you have too much of it, right? Okay. So what your body does, your liver tries to metabolize it and usually stores it in fat, right?
Oh, interesting.
If it can't pee it out, if it can't poop it out, it's got to do something with it. It stores it in fat.
Yeah,
right?
Usually you release it through pee, poop, or sweat.
Correct, right? And if you can't do that, then because it might not be water soluble, it might not be whatever, it will go into fat. I'm not the expert in this anymore, right? Or neither was I ever, but when I was learning physio and stuff, we got it. But so anyway, that's the theory, right? And then you accumulate these toxins, whether they escape through the cups, To me, it's like we have this obvious physics problem. You're putting so many newtons of force on a tissue, blood accumulates there and causes it to be red. But then we see the low-hanging fruit, and we're like, no. There's all these chemicals that are coming in. It seems less likely to me.
Yeah. No.
It's a hard thing. We don't know everything in science, in medicine. And, we're constantly changing our mind. It's a good thing because
definitely.
If we're not, it means we're not trying to grow and strive and question ourselves, right? Like, I want somebody to change their mind because it means that they've learned something new. But also, there's some things that at this moment, I'm going to make a call. And the call is, that's bullshit.
Yeah. And I think it's appropriate to have a healthy level of skepticism with regards to certain treatments that you may find on the internet.
Correct.
Right?
Yeah, definitely.
I mean,
there's full of bogus claims.
Are those things clinically studied?
Yes.
Is there vibe? I mean, and look, I'm not saying that, and you're not saying it either, that there's no point in cupping.
No.
There's definitely.
I use it.
Yeah, exactly.
Yeah, I use it.
There may be some benefit, and if somebody feels better from doing
Correct.
it, but doing this shotgun blast approach
Yeah.
is probably not the best.
Totally.
And if we're going to do something, it's got to be for a specific reason.
Yeah.
And to treat a specific ailment or something like that.
I'm sure there's people that have gotten this shotgun blast approach and left feeling great the next couple of days.
Yeah.
The question is it placebo, or did we really do something that was physically beneficial to them? Because the placebo effect outside of just pills is really real.
Yeah.
Right? Like, there's all these components in physical therapy that we actually use that to our advantage because people have these stories of chronic pain. I almost need to use the placebo effect sometimes in their story. It has to match biomechanics. I'm not lying to them and giving them nothing. But I almost need to use their belief systems about the treatment to enhance it because they've had a false narrative about their body for so long. We have to rewrite that narrative. Mm-hmm. And for somebody that might go in there and have the whole body cupped and manipulated and stretched, they really feel like in an hour a lot happened to them and they may walk out feeling a lot better. So I'm sure there's some people out there who have gotten that treatment and are like, wow, I feel amazing. That doesn't mean it's the right thing for everybody or even that person at that time. It just meant that they felt some improvement. Right?
Okay.
We can't, that's where studies come in, right?
Yeah.
But also studies aren't the end all be all. Also what my expertise as a clinician and your beliefs as my patient or client matter because studies constantly get replicated and shown that they're not valid. So it also matters what I think from my years of expertise and what you think as a patient or a client because it all has to come together. That's the highest form of evidence-based
or
practice.
information gets updated.
Correct.
Yeah. And that's kind of the purpose of the scientific method is the pursuit of truth.
Correct. Right.
So, yeah. Well, very cool. I think, something like that, little out there.
Yeah.
There's definitely some benefit in cupping. But, people, please, if you're going to be going to a clinic and they go, I'm going to cup your whole body, avoid that place at all costs. Anyway, everyone, we want to know what you think of cupping. Do you think it is a viable means of treatment? Do you get cupped often? Please let us know in the comments. Like and subscribe if you enjoyed this video, and we'll see you in the next one.
Sweet.